Welcome back. The White House said this week that it will use tariff revenue during the government shutdown as bridge funding for a supplemental nutrition program known as WIC, or Women, Infants, and Children. That sounded promising to those who receive those benefits, and yet Vice President Vance said at yesterday's cabinet meeting, and when you play this sound, you'll see the cameras did not get a really good angle on him, that funding could expire really soon.
There's a low-income food program, the WIC program, that my mom actually used when I was a baby. That program is about to be underfunded, and it's about to get cut off because Chuck Schumer won't open the government.
I asked the WIC National Association's policy director, Ali Hart, about all of this yesterday. Take a listen. Ali, thanks for coming in. There are a lot of mixed signals from the administration. Caroline Leavitt, the press secretary, said that tariff revenue will be used as a stopgap to keep WIC funding going. Then the vice president said this week it's going to end. The president hasn't really weighed in on it directly. What do you know, and what are the deadlines facing those who receive WIC assistance?
Sure. So right now on the ground, we know that states are really starting to struggle and feel the pain. We heard from one tribal agency that they told participants yesterday that they would be closing their clinics today and turning off benefits today. The good news is that overnight, USDA was able to get them a reallocation of prior fiscal year funds. So they've got a little money now, but that money won't last too long. We think they can get through maybe another week. And so that's why it's so important for us to find out what's going on with the White House tariff money that they have promised. At this point, we're really relieved to hear that they are making this funding available, but we need to know how much will be available, and we need to know when folks will get it, because right now states are under enormous stress and very close in some cases to running out.
And as I've read, it's about 7 million Americans are beneficiaries of women, infant, and children funding and assistance. It flows through the states, and the agency is the Department of Agriculture. Do I have that right?
Exactly correct. So we serve 6.9 million pregnant moms, postpartum moms, and then babies from birth all the way up to their 5th birthday. As of the last month we have data for, and that's this past May. That's right.
And that assistance not only is for the children living, but those who are in development, and right, there are real-world benefits from this assistance.
Absolutely. So this program, we call it sort of the original Food as Medicine program. It was developed by a pediatrician out of Johns Hopkins 50 years ago. And he started it because he was seeing babies born too early with low birth weight and even a really high rate of infant mortality at that time. So we're really proud to say that now, 50 years later, we have successfully reduced infant mortality, reduced preterm birth, reduced low birth weight, and improve maternal health outcomes in this nation. And so the stakes are very high for WIC. We need to keep the program going.
And what's been the experience in previous shutdowns?
Sure. So this shutdown is a little unique. It's more dire because it started at the beginning of the fiscal year. So WIC is a discretionary program, unlike some other nutrition programs where it's a mandatory entitlement.
Meaning the funding's guaranteed.
Right, exactly. WIC it's a discretionary program. So every year Congress has to provide new funds, and there's a cap on that. And so this year, coming at the top of the fiscal year, there was no new funding available for folks. And there's a little bit that they can take from last year, but very little, because the program is actually increasing in participation, which is fantastic. But that does mean that we're spending more of our funding. And so there really wasn't much to pull over from the prior fiscal year.
And this funding is a hedge against inflation, is it not?
So
in some ways?
That's a good question. I think that we are dealing with inflation in terms of food costs. So it has, to the extent that inflation has increased grocery costs, WIC does pay for, we feel that impact on the WIC budget. So that is part of why actually there's less carryover funding going into this fiscal year, is because we did
higher
have to spend
prices
more.
Eat into allocated
That's
reserve.
right.
Thinking about the calendar, the month of October, when do dates start really becoming seriously problematic for your recipients?
Yeah, so we are already seeing in a couple of states, they are reducing clinic availability because there's actually two types of funds in WIC. There's food dollars, and then there's essentially nutrition services and administrative dollars. So states are in a better shape right now on food dollars because the federal government was able to make the contingency fund available for WIC. So that's what folks are working with right now. Last night, they got that reallocation, which is giving them a little bit of the admin side, but some are very tight. So we are seeing in Washington and Kansas, other places, we're seeing some clinic closures or significant reductions in staff or hours or services. So we're starting to see some of these impacts now. We're hoping that reallocation that folks got last night gets us maybe another week if it's kind of in the right places, as we hope it is. And then I think we really need the White House to get that money out that they're promising. It needs to go out next week so that we don't see large-scale disruptions.
Allie, thanks so much for coming in. I appreciate it very, very much.
Thank you, Major.